Today, let's talk about West syndrome. Firstly, the terminology has changed. It's no longer called West syndrome, but infantile epileptic spasm syndrome or IESS. So, when it comes to IESS or West syndrome, there are two landmark trials which you should know. The first is the UKIS trial, which happened in 2005. This trial was limited to the United Kingdom. It recruited 107 infants. Notably, it did not recruit any tuberous sclerosis patient, and that is considered a drawback of this trial as well. So they randomized the 107 infants into two groups. One received hormonal therapy, which could be steroids or ACTH. The other group received vigabatrin. The outcomes that they measured was cessation of spasm at day 14 and the final neurodevelopmental outcome which they measured at 14 months. They used the VBA scale for this. So what they found in the study was that the spasm cessation at day 14 was definitely superior with hormonal therapy, 73 versus 54%, and this was statistically significant. More importantly, the final neurodevelopmental outcome at 14 months did not differ among the two groups. But this was the trial which proved that hormonal therapy is definitely superior to vigabatrin when it comes to spasms. The second study which you should know is the ISIS trial, which was conducted in 2017. This recruited 377 infants across 5 countries, and this included both tuberous sclerosis as well as non-TS patients. They compared between monotherapy with hormones, that's ACTH or steroid, versus combined therapy, which included vigabatrin as well as hormonal therapy. The outcomes which they measured was spasm cessation, but not just at 14 days, but until 42 days, and also neurodevelopmental outcome at 18 months of life. And they found that combined therapy definitely has a better spasm cessation rate, 72 versus 57, and this was statistically significant. And significantly, it had a shorter time to achieve spasm cessation. But yes, the neurodevelopmental outcomes did not differ. This study was the study which proved that combined therapy may be better than giving either vigabatrin or hormones alone. I hope this was useful.